all the time for a 24-hour breast lift. I mean, that just seems impossible to me, too.
So, it was a genius idea, concept-wise, is that you can inject some saline, which is really something that you would get in an IV anyway, into the breasts and give the patient the look of what a breast augmentation would really be for them. So I guess in a sense, it started out as a way of trying to show the patient what they would look like if they really did get a breast augmentation. The problem is it's kind of been bastardized in the sense that people are doing it because they have a wedding this weekend. So they'll go in, they'll get it done, they'll get pumped up with some saline. It'll work, it'll start to dissipate over the course of about 24 to 48 hours. The problems again are you're going to have to get some sort of a needle injected into the area. You know, you're also trusting that what's ever going in is sterile, it's not going to create an infection. Could that needle puncture a lung? Could that needle cause a hematoma, which would be a collection of blood that starts to happen because with that needle, you also got some bleeding that occurred. So it really, a lot of these things sound, like you said in the beginning, so good to be true, but you're really not thinking past the result that you're looking to get. You're not looking at some of these other things that could happen that could be bad.
How do we make sure, because a lot of what you're talking about right there is who's doing the procedure and in what setting. How do we make sure that our doctor is certified, is really a doctor? Is there any, is there a website, is there a database, is there an organization?
Absolutely. So you could definitely check to see, is my doctor a board certified plastic surgeon? Is he a member of the American Academy of Cosmetic Surgery? When you're calling to make that appointment, you can ask the receptionist, what kind of a doctor is he? And like, how many years of training has he had to do X, Y, Z? So those types of things I think are like standard first line type things. The next thing that you can do is really go in and really talk through what you're having done and why this is really a good procedure for me. Because I think that's the number one thing I try to do with all my patients is that I try to give them like a whole list of things that could help with what their concern is. And the one that they really latch onto may fit their pocketbook. It may fit their social lifestyle. I have something that'll work, but I'm going to have you take 2 weeks off from work. That may not work for me. So you really do want to have multiple options because, again, like you know, with some of the other things you were saying, you know, if the only thing that this guy can offer you is one thing, that may show you right there that he's not so trained in the whole realm of the specialty.
What about pressure, too? If a doctor or someone who's administering these types of procedures, if they start pressuring the patient into doing it right now, let's get this done. Would that be a red flag as well?
Absolutely. Because I think more than anything, you want it to be the reverse. When I have a patient come in and I see that they're so excited, they can't wait to get this thing done for whatever reason, that makes me feel good and I think that they're really excited about it. And I think, you know, mentally it's going to be a great thing for them because they're really engaged in it. If you see the doctor is like over the top concerned about getting it done right now and wants to do it, there's got to be something that like a red flag that may, you know, show up that makes you think maybe something's wrong here. Let me just go home and think about it a little bit.
Interesting.
You know, I think it's important.
It's really, it's good. It's good, important information. If you can't afford to have it done, you certainly can't afford to have it fixed.
That's right.
So get it done right the first time.
I
got all those good one-liners for Dr. Davis there.